Hello, my name's Brett. I'm talking about diabetes type 2 today. Diabetes mellitus is a condition where there is too much glucose in the blood. It's a chronic condition where high blood sugar levels are caused by insulin problems, and it is a full scientific name for what is commonly known as diabetes. In type 2 diabetes, the body doesn't effectively use insulin, causing glucose to build up in the blood. The symptoms are, in the short term, high levels of glucose in your blood make you feel tired. The kidneys work harder to pass some of the excess glucose out through the urine, so you may go to the toilet to pass urine more often, and this can lead to dehydration and feeling thirsty. Other symptoms may include always feeling hungry, cuts or wounds that heal slowly, itching or skin infections, blurred vision, headaches, unexplained weight change, can be gain or loss, feeling dizzy, and mood swings. If it's untreated in the long term, high blood glucose levels can damage small and large blood vessels and nerves, which can cause damage to your heart, brain, kidneys, eyes, and feet. People with diabetes often have cardiovascular symptoms such as high blood pressure. They may also have high cholesterol levels and obesity, which are risk factors for heart disease. Of all the complications of diabetes, cardiovascular disease is the one that is most likely to be fatal. Some numbers with type 2 diabetes in Australia. In 2021, an estimated 1 in 20 Australians were diagnosed as having diabetes. Type 2 diabetes accounts for over 85% of all diabetes in Australia. And between 2000 and 2021, the number of people living with diabetes in Australia almost tripled, from 460,000 to 1.3 million. One of the diagnostic tests for diabetes is HbA1c, glycated hemoglobin. This is a non-fasting test, and it's a measure of your average blood glucose over the last 2 to 3 months. The tube used is an EDTA. The sample is sent to biochem at room temperature. Another test is the FBG, the fasting blood glucose test. This test measures how much glucose is in your bloodstream at a certain time of day when you haven't eaten for 8 hours, such as overnight. An FX tube is used. The sample is sent to biochemistry at room temperature. The fluoride oxate additive acts as an anti-glycolite agent, preserving the glucose concentration until the blood is tested. Some laboratories or specific orders might allow for a lithium HEP tube or an SST, but the sample must be delivered to the lab promptly for analysis, because the blood and the glucose continue to interact with one another if it's not stabilised. Another type is the non-fasting or random blood glucose. This test measures how much glucose is in your bloodstream at a certain time of the day if you haven't been fasting or have eaten something recently. An FX tube is used. The sample is sent to biochem at room temperature. Some medical terms are hypoglycemia, which is high blood glucose. This is a condition of having abnormally high blood glucose sugar levels. Diabetic retinopathy. This refers to damage to the blood vessels in the retina, the back of the eye, caused by diabetes. It can lead to blurred vision and, in severe cases, blindness. Diabetic neuropathy is damage to the nerves caused by high blood glucose levels over time. It can cause symptoms like numbness, tingling and pain, most commonly in the hands and feet. Hypoglycemia is the condition of having too low level of glucose in the blood. Diabetes mellitus is a metabolic disease involving inappropriately elevated blood glucose levels. A fun fact, ancient civilizations noted the sweet nature of urine in affected individuals, leading to the name sweet urine disease, or more formally, diabetes mellitus.